Good afternoon. On behalf of the author, we would like to present the paper called SYNDIAG and Expert System for Disease Syndrome Diagnosis of Traditional Vietnamese Medicine. The author is for people, and on behalf of that, I would like to present this presentation. The content of the presentation consists of the five parts. One is introduction, which show motivation of our study, and the second part is describe structure of the system. In this section, we will present four components of the system. This is knowledge base and inference engine, and also knowledge acquisition, and last session is explanation. After that, we will describe and demonstrate some example of the performance of the system. Then we also show some evolution of the system with the comparison with the diagnosis of practitioner in traditional medicine. Finally, we will give some conclusion and show some future work. In the introduction, yes, you know that the Vietnam medicine consists of traditional Vietnam medicine and also Western medicine. Actually, in every hospital in Vietnam, there is two kind of medicine. One is the Western medicine. It is normally, and also in every hospital there are one department of traditional medicine, which will treat exam and treat the patient by traditional medicine method. Usually, traditional Vietnamese medicine had a history of thousands of years of experience in disease prevention and treatment. This medicine based on the theory of yang and yin, five movement, and also unified human nature theory. Vietnamese people apply traditional medicine to treat the people, Vietnamese people, for 1,000 years. There are four methods in examination. In traditional Vietnamese medicine is inspection, auscultation, inquiry, and palpation. For disease, symptom-based position status, and common trend of disease to infer the syndrome of organ. After full method of examination of the patient, the medical doctor can get a set of symptoms of patient, and then which symptom can be considered as input for the diagnostic system of disease syndrome in traditional Vietnamese medicine. The question is why we develop such system, SYNDIAG, a rule-based expert system for disease syndrome diagnosis in traditional medicine. Because in Vietnam now there is a lack of experienced traditional medicine practitioner, and we need to keep the experience and this medicine for the our children. To summarize, the main contribution of this paper are: first, we apply a novel model of diagnosis of traditional medicine based on MYCIN-like system approach to develop SYNDIAG, which can improve the limitation of fuzzy McMinn inference. Second, we build a rule base for diagnosis of this disease syndrome of traditional Vietnamese medicine. And third, we implement the expert system SYNDIAG, which consists of a rule by an inference engine applying a Boolean group operation to combine the contribution of confirmed conclusion and also excluded conclusion of the rule having the same conclusion. First, our expert system SYNDIAG can help to improve the shortage of experienced traditional medicine practitioner in Vietnam. Of course, yeah, with the module of explanation, which can also show how the system SYNDIAG inferior the disease syndrome. It is very helpful for teaching the student, and also um, um, this system can be a good teacher available anywhere at any time. Then now we show about structure of the system. Our system, there is the four component. First of one is the knowledge base. Knowledge base here in the form of the if, accident, and then conclusion. Accident here that mean the conjunction of the symptom, and the conclusion that means syndrome in the Vietnamese traditional medicine. And there are some the degree we see of ES and SYNDIAG. That means it is represent the belief degree of confirm or exclude the conclusion SYNDIAG if there is exists the precedent EH. Here, the EH is a symptom or elementary conjunction of symptom SI in the form of SH is S1, S2, S3, and negation of M. And for HE, it is taken from 1 to M. And SYNDIAG is the disease syndrome. In inference engine, here we apply 4 steps of inference engine. That's it. We follow the doctor way of making a disease syndrome disease. First, we should to calculate the global way of the diagnosis of the disease syndrome. SYNDIAG is given by a questionnaire Q, and the contribution of a rule R given Q is defined. In the step 1, here the user assign the way for the system, that is the way of the Q of SI. In the step 2, the system can calculate the conjunction in the rule premise as E by the formula here. We have about the 3 formula for the conjunction, formula for negation, formula for some kind of the logic, yeah, of predict. And so the step 3 should calculation of the contribution of the rule R given by Q by formula CTR here with some the condition. And the fourth, system can calculate the contribution of all rule R1 to Rn given by Q when all of these contribution of rule with the same conclusion. And one use one use the group operation to to combine the contribution of all rule um, with the same conclusion. Yeah, we show in the equal one, the formula. And here there are the inference engine for more precisely diagnosis of digit syndrome. It depends on the degree of the MUI of the PQ and syndicate when they is mean is one that mean the absolutely confirmation of the conclusion key. And for example, if degree greater uh, than epsilon and less than 0.6, that mean possible confirmation of the conclusion. And then if the degree of the MUIC of the PQ and key is -1, that means the absolutely conclusion of the exclusion of the conclusion key. Here we have the 7 type of the condition for diagnosis of this syndrome. In the knowledge acquisition, the system can select the rule by two approaches. First approach is a rule can select the rule from experts. Of course, yeah. The most rule are formed by the traditional medicine physician and doctor from the Thai University of Medicine and Pharmacy. Here, to form this rule, we listed all the symptoms seen in the patient of disease syndrome, about the 40 such symptoms, and store this symptom by the frequency of their occurrence and by the importance of symptom for each disease syndrome. Then we form all of possible combination of the most frequent symptom and some combination involving less frequency symptom and symptom with less importance, and ask the traditional medicine practitioner to estimate the degree to which the combination of symptoms confirm or exclude the disease syndrome. And another approach, that means we can select the rule from the statistical approach. And so in the explanation, in this explanation, the system SYNDIAG show its conclusion. That means the set of patient symptoms and the rule that match each set. As a result, the user can see the intermediate diagnostic conclusion from all 4 steps of the diagnosing process and the way the rule affect the final conclusion. And this explanation called the how, that means we use a forward chaining in the inference engine to show the explanation how system can have the conclusion. Here is the some example of performance of the system. Here is the interface of the system, which include the some button of knowledge acquisition, syndrome diagnosis, explanation, and fast exit. And then um, um, and then another example of the performance of the system is knowledge acquisition. Uh, the user, the expert, and knowledge engineer can use the button expression, articulation, interrogation, and pulse examination to select the the symptom from the patient, not from the patient. That's it. The expert can give setting, and then we form the rule with some degree for the conclusion. And another example that may result of some syndrome diagnosis. Yeah, when we select the symptom from the patient, one can get some conclusion. For example, influenza caused by the wind heat syndrome with the degree 0.9. That is the unknown confirmation of the disease syndrome. For examination, here we can see about some explanation. That means the system can list all intermediate result in the process of the forward chaining of the system and show to the user and the doctor. They can believe the system. For the evaluation, of course, yeah, we apply it to several patients and compare the system diagnosis with the diagnosis of the experienced traditional medicine physician from the traditional medicine hospital. The information about this patient were added to our database, and in the majority of case, the system SYNDIAG diagnosis was the same as the recorded by the doctor, where were different in diagnosis only in a few cases in which patient had rare symptoms, which we originally did not take into consideration in our design of the system. And then, of course, yeah, in the future, we also updating the list of symptoms and the list of combination of symptoms by adding the new rule and slightly adjusting the possibility value of several existing rule. And that is step by step we can make the knowledge base make the useful and make intelligent. In the conclusion, of course, the paper present an overview of the SYNDIAG project, rule-based exposition for this syndrome diagnosis in traditional Vietnamese medicine. Here we describe some notion of traditional medicine and the show the lack of the traditional medicine practitioner. Therefore, we need to develop SYNDIAG system for disease syndrome diagnosis in traditional medicine, applying approach of the MYCIN-like system. And in order to improve the system, we keep maintaining and updating the system rule base, and we try select more rule and make more the rule base for more accurate and robust. We continue and so to work with the practitioner in hospital and in Vietnam, especially in the Thai Nguyen hospital. Here we also show some example of rule of some disease syndrome in knowledge base for the disease syndrome. And here we is finished to present the overview of the system.